Hi friends, I am Dr. Teena. Today we shall understand what is IVF, who all require the IVF and how is it done. See, IVF is the artificial reproductive technology where IVF, in vitro fertilization, that means the fertilization happens in the vitro, that is in the lab. So this is also called as the test tube baby. So before understanding IVF, let us understand in vivo fertilization. That is, how does the fertilization happen in our body. So let's understand what is fertilization. Fertilization is the basic term where the baby is formed by the fusion of egg and the sperm. So the egg comes from the mother and the sperm comes from the father. So let us understand first in vivo, or inside the body, how does the natural pregnancy happens. See, this is our reproductive system. This is the uterus where the baby grows. These two are called as the ovaries. Ovaries are meant for egg development and the egg release in our body. And these two tubes are called as the fallopian tubes. And the lower part below this uterus is called as the vagina. So after having sex, in the upper part of the vagina, the semen gets collected. And the sperms in the semen swim and reach the uterus. And from the uterus, they swim and reach the fallopian tube. And once the egg develops and gets released from the ovaries in the process of ovulation, so that egg will be sucked by the fallopian tubes and the egg is going to reach this part of the fallopian tube. So in this part of the tube, the egg will fuse with the sperm to form the baby. So one cell baby is called as a zygote. So one cell becomes 2, 2 cell becomes 4, 4 becomes 8. So the number of cells keep on doubling up. And as it keeps on doubling up, the developing baby keeps on rolling through the fallopian tubes and it comes and gets attached in the inside of the uterus. We call this process as an implantation. See, this is how our natural pregnancy happens in the body. So now, coming to the question that who all are going to require this in vitro fertilization. See, for the formation of the baby, males are 50% responsible and females are 50% responsible. So coming to the males, if anybody is not able to have sex for any reasons like not able to get erection or ejaculation, that may become the reason. Or if anybody's sperm has some problem, like normal sperm count in the semen is, it should be more than 16 million per ml. If the number of sperms are too low, that becomes an indication for the IVF. So coming to the female factors, so if any lady is not having good number of eggs in her ovaries, then she may require the IVF pregnancy. So if anybody has got the block in the fallopian tubes, then also IVF pregnancy may be required. So these are all the common indications where we require the IVF pregnancy. How is IVF done? So for the female partner, we'll be giving the good medications for the egg development in the ovaries. So how we will come to know that eggs are developing or not? So that is going to be monitored by the scans. Those scans are called as follicular scans. And with the follicular scans, we are going to see like how many follicles are going to develop, right side or left side, all those things. See, once the follicles develop, usually in the natural cycle, they are going to rupture and the egg is going to come out. But in case of IVF cycle, the ovulation, we will not let it happen. So even before the ovulation happens, we will be taking out all the eggs from the female partner's body under the anesthesia using a very, very small needle. We are going to suck out all the eggs and that will go to the IVF lab. And the male partner will be giving the semen and the baby forms. The fertilization happens in the lab by the fusion of the sperm and the egg. So we are going to see like how many babies are formed. One cell baby is called as zygote, and that when keeps on growing in the early stages, we call it as an embryo. So we will look at the embryos, like how many embryos are developed, and the grading will be done. The good quality embryos will be selected and that we will be putting back in the uterus of the lady. We call that as embryo transfer. So this is how IVF is being done. Thank you.